Emergency rooms aren't built for long-term care. That's why Maria Manning is so confused. Her son sat in this ER for 2 months.
That's equivalent to just being in the airport, trying to get on an airplane for 2 months.
Jalen sat in limbo because he didn't need surgery. He needed mental health care. But Jalen is an adult with autism and developmentally disabled. Right now, the state only has the specialized staff to care for about 35 people like him in crisis.
He completely ripped the banisters off.
In November, Jalen had a dangerous and destructive breakdown.
Everything was here, like in the space, like the banister pieces, the big mirror, the broken glass.
That's when she decided no more. After paramedics took Jalen to the ER, she refused to pick him up. So there he waited until one of those 35 beds opened up. Maria is not alone. Just listen to what Piedmont Healthcare told a legislative study committee.
So we absolutely are having patients that do hit 100 plus days sitting in our emergency rooms or on our medical floor beds. This is a daily situation.
Grady Hospital told the committee it's not just a Piedmont thing.
It looks like we're seeing almost about 10 times the amount of patients within the Atlanta area within our emergency department.
Federal data shows more than half of those people have no insurance or rely on Medicaid. And they are the ones getting stuck. Piedmont's solution?
The only way to get them there is for us to pay for it.
In their presentation, Piedmont says it spent $3 million to get patients out of its ER. Despite repeated requests, neither hospital would talk with us. So we sat down with Aviva Berman, who also presented to the committee. Berman is with the Atlanta Regional Collaborative for Health Improvement, or ARCHE. It meets with hospitals across the metro to figure out how to help. She told lawmakers, we need a structural solution. What do you mean by a structural solution?
I don't think I can dive into that.
So why is it that you guys can talk about this in a legislative committee and say all of this to people there, but you can't say it?
Yeah, I mean, what we hope for is for more services and programs and crisis and respite beds.
Beds that can help people like Jalen get the care they need without having to wait months and taking up space in the ER to get it.
I'm gonna fight with every breath I have to make sure he gets what he needs.